ready to start recording? Oh, hey! Okay, thank you. Thank you, Madam Administrator or support team, whoever. I want to welcome everybody to Appropriations and Human Services public hearing on the Autism Waiver Renewal process presented to us by Department of Social Services. I will ask my co-chair if she has anything to say. But before my co-chair speaks, I just want everybody right now to please acknowledge and help me say happy birthday to my co-chair, Kathy Ann Austin. Happy birthday to you. Happy birthday to you. Happy birthday, dear Kathy. Happy birthday to you. How old are you?
Hey, it's tough to be 52 again.
You're 50, I know, 50, okay.
Very old. Thank you all. Appreciate it.
That was our conversation before, Senator Austin, so sorry.
Thank you. And Senator Moore, are you on? I think you are.
I am here. I just want to say hi to everybody. Good to see you all. Thank you.
Thank you. And Representative Abercrombie.
Good afternoon, everyone. Welcome. And I'm very excited about this renewal for the autism waiver. So let's begin.
I'm trying to see, do I have any of the, let's see, is
Representative France will be late.
yes, I got Representative Francis. I was looking to see if the Senate was here. No,
our Senate ranking member is not with us.
okay, all right. Well, Representative Case.
Well, I look forward to it. I know this is talked a lot about Kathy, and this is in her wheelhouse, and we look forward to moving this this grant forward with about 10 amendments. So
Good, great. And the Senate ranking member for Human Services is
Senator Berthel, but I don't see him on here unless, Madam Administrator, do you see him?
No, ma'am, I do not.
okay. All right. Well, I'm sure they'll be joining us, especially by the time we get to the voting part of this agenda. So with that, I will welcome the commissioner, Senator Summers. I will welcome the commissioner. I saw her for a brief moment. Commissioner Gifford?
I'm here, Representative Walker. Can you see me now?
Good to see you. Thank you. Thank you. Would you like to begin? Would you like to begin and introduce your team that's here to support you today?
Yes, thank you very much. And good morning to you. Happy birthday, Senator Austin. Good afternoon, Senator Moore and Representative Abercrombie and all of the members of the Human Services and Appropriations Committee. Thank you for having us. I'm Deidre Gifford, the Commissioner of the Department of Social Services. I'm joined by a number of team members here today to help answer your questions. Bill Halsey, our Deputy Medicaid Director, is here. Amy Dumont, who is the one of the program managers for the autism waiver and has a lot of detail. Michael Slitt from our legal office, who's been handling the CMS and legal side of this waiver, and David Seipel from as our legislative liaison. I think that's the team. I don't see anybody else. Apologize if I missed anybody else from DSS. So we are here to seek your support today for the renewal of the department's autism waiver. As you know, we've submitted our written testimony. I have a few remarks before I turn it over to Bill and Amy, who will walk through the specific proposed changes. First of all, as background, this waiver in DSS is for persons with autism, providing home and community-based services for those who have autism but do not have an intellectual disability. To qualify for waiver services, an individual must have substantial limitations in 2 or more major life activities. the functional impairments must have been diagnosed before the age of 22 and be expected to continue indefinitely. In terms of the big picture of the participants in the autism waiver, we are currently serving 170 clients under the waiver. We do have a wait list of 1,996 individuals. The average annual cost under the waiver is $19,400. And the cap on costs expenditures is $50,000. This waiver was last renewed on January 1st of 2018, so the full 5 years ago. And the renewal for this cycle will begin on January 1st of 2023, assuming your approval and concurrence by CMS. So those are the main facts of the waiver. We do have not a lot of proposed changes to the underlying waiver. We do have 4 things that we're proposing to change that we think will improve services and in some cases make the provision of services more available. So I'd like to turn to Amy Dumont, who will walk through the 4 proposed changes to the waiver. And then, of course, we're happy to entertain any questions that you have. And Bill, Amy, and myself and others are available for that group.
Amy?
Good afternoon, everybody. Thank you for joining us here today in regards to the autism waiver renewal. I'm going to just highlight for you some of the significant changes to the waiver, which I think are going to serve our participants very well. So the first one I wanted to highlight was we're going to add a new service to the waiver entitled nutrition. So nutrition is defined as the clinical assessment and development of special diets, positioning techniques for eating, recommendations for adaptive equipment, and counseling for dietary needs related to the medical diagnosis of our participants. And it also includes training for support staff to ensure compliance with the participants' dietary needs. These services are not covered under the Medicaid state plan. And this service in the waiver will be limited to 25 hours of service per year and will require prior authorization from the client's case manager. So we added this service to the waiver to help our participants with making healthier choices on the waiver currently. And as we anticipate additional entry to the waiver, we do have some clients that have some special needs in terms of maintaining healthy dietary choices, many that have diabetes and others with other chronic medical conditions. So we felt that that was something important to bring to our population. So that's the first change. The second one is the waiver was expanded legislatively to add 50 slots beginning in July 1st of 2021, which we've done that, and that brings our current census on the waiver, as the commissioner said, to 170. We were now allotted an additional 150 slots to begin in July 1st of 2022, which I'm seeking an amendment as well from CMS to add those additional slots. And we're currently in the process of recruiting staff to be able to accommodate those upcoming needs and changes in the caseloads of my case managers that support these individuals. So those additions are forthcoming, hopefully in the coming weeks. Thirdly, I wanted to make a change to the definition of social skills group. These are all services in the waivers currently: social skills group, life skills coaching, and clinical behavioral support services. The change in the definition that I'm making is to permit these services to be delivered not only face-to-face, but also in a virtual format if necessary. We found that through the public health emergency, that a lot of our clients use services virtually, and some are still hesitant about allowing folks to come into the home. So that would be a good alternate means of delivery of that service. So I'd like to keep that beyond the expiration of the PHE and when our Appendix K emergency orders end. So that definitely was a beneficial area that we put in during the PHE. And then lastly, what I'm looking to do is, and this was up for a little discussion today earlier, some of you had attended the Autism Advisory Council or may have watched that. Life skills coaching, I wanted to modify the definition of that service to remove the need for a bachelor's degree and only require a high school diploma or equivalent, as well as experience working with individuals on the autism spectrum. I wanted to remove that requirement for not just for agency providers, but also for individuals who are enrolled to provide services to our clients. And that would also, we're having, as you know, provider retention issues and recruitment for providers. So that would also open up that that group who would be able to deliver that service. The requirement would also be that they did a quarterly, it was mandatory that they do a quarterly provider training. I have a contract with the Center for Children with Special Needs. Dr. Palmieri, Dr. Powers and his team do a quarterly training for the providers. So that would be important that would be mandatory. But that certainly was up for a little discussion today on whether or not I remove the bachelor's degree requirement and just do the high school diploma or diploma.
We're having a little technical difficulty.
Yeah, I think she is frozen.
Yeah.
So let me just, Amy, if you can hear us, I'll try to close this one out, and then I think we're prepared to take some questions. So as Amy was saying, the department is recommending flexibility on the staffing requirements related to this, removing the requirement for a bachelor's degree, but inserting training requirements. And so that's the fourth adjustment that the department is recommending to the waiver. And just to restate, the provider training is offered quarterly and is mandatory for all staff working with individuals on the autism waiver. And those four represent our recommendations for the waiver amendment.
Okay. Thank you. I hope she gets back on. Let's start with questions. Thank you. And I'm going to ask everybody to try and do it in 2 questions, and then you can come back around. I know my senators know that skill. So I want to start with my co-chair, Senator Austin, the birthday girl.
Thank you. Thank you very much. So my first question is relative to nutrition, the nutrition component of it. I'm just, she talked a little bit about diabetes, and I want to make sure that it's also to help out those that might have food sensitivities that are making it hard for them to get a balanced meal in. So is that a broader definition, Bill, if you know, on that, or is it strictly for diabetics and those that have diabetes?
I think diabetes, Senator, was an example. So it is my understanding, and happy to confirm that when Amy comes back on. But
She's on now.
Okay.
Sorry about that. It's
That's
embarrassing.
okay. Amy, did you hear the question?
I did not, Bill. Sorry. Thank you.
So my question was, Amy, was on the nutritional aspect of things, is that segregated or simply for diabetes, or could it be for someone who has food sensitivities, even food allergies, but food sensitivities that keep them from having that balanced diet? Do you know if that would be more broad than just diabetics or those with diabetes?
Yeah, that was the intent, Senator. Many of our clients on the autism spectrum sometimes difficulty with following through with special diets or even maintaining healthy diets. So I think that would be able to support them in terms of making the best decisions if they had allergies. Absolutely. That's not just for diabetics or folks with other comorbidities. That could help with some coaching and training for the clients and their families.
And thank you for that. My second question is relative to the concern on the educational component of people. Personally, I'm in favor on its face for us to broaden the scope who can participate in this job. So that being said, I want to make sure that we're not giving people a job they can't handle. And you're talking about training, and who is going to pay for that training? Is that something that perhaps would fit in so that an agency who may not be able to afford that training can still participate in the training program? How would we handle that piece?
So I may need some clarification, but I do have a training contract with the Center for Children for Special Needs that provides training to not only my staff, but also to providers. So the training is not a cost to the provider agency, but maybe a cost in some way in terms of removing that person from the workforce for those 4 hours on a quarterly basis. I'm not quite sure. I have some thoughts on how I want to handle that, and I want to bring that back to the team at DSS. Does that help to address that at all?
Well, it does. I just, I think that it's starting to address the issue. I just want to make sure that at the end of the day, we know how the training is being paid for and how we're covering that scope of work. So thank you very much, Madam Chair.
Thank you. Next, Senator Anwar.
Thank you so much, Madam Chair. My two questions in the first round are one, are we going to look at the consistency of the food as well because of aspiration risk in a certain population? I want to make sure that's covered as well because of, I know you're looking at positioning, and I know that sometimes the consistency or thickening can help reduce that risk. And the second question is that as we increase the number, is there a concern about a cliff that in 1 year or 2 years' time, we will not be able to have that coverage? I just want to confirm that that's not going to be an issue. Thank you so much, Madam Chair.
Amy?
Thank you. Thank you, Senator. In terms of your aspiration, precautions, and risk, many of our clients on the autism waiver are higher functioning, but to address that risk, certainly we have individuals that have visiting nurse services in place, as well as any other therapies to include speech therapy if needed. So we certainly could put those supports in place if that were an issue that was identified that client needed. I don't see where this service will be a medical service in that sense where they're addressing risk. It would be more of a coaching and education component for our clients, if that helps address that question.
Yes, it does. Thank you.
The second piece of your question was in terms of the sustainability of that service over the long term. So I'm not a fiscal person, I'm a clinician, but with the help of my fiscal staff, we have determined this service has not been available in the autism waiver before, but has been available in other DDS waivers. And the use of that service has been very limited. So our great fiscal folks here have anticipated the need at being less than 20% of our population. So as we go forward, in it not being a service that is very expensive, I'm not sure that will be an issue, but I guess if we had to address that in the future, we could, but I don't I don't see that we have a great population that will need it, but certainly have many that could use the coaching. So I know that doesn't directly answer that, but
Madam Chair, do you mind if I
Sure.
clarify
Go
my
ahead.
question? My question was, the second question was more about the increase in the number of slots. So once we increase the slots, is there going to be a cliff after a certain time?
it's hard for me to anticipate right now, Senator, because I do not know the complexity of those folks that we will be taking off of the wait list going forward. We're looking at those cases on a case-by-case basis. I do not know their needs. They have been on the waiting list for quite some time. So we're going to have to find more out about those folks as we begin to assess them, as we put them onto the slats. So it's hard for me to make an assumption based on that.
Okay, thank you so much, Madam Chair.
Thank you, sir. Representative Case.
Thank you, Madam Chair. Just a few comments and a question. Anything we can do for the autism population or any special needs population, as you know, is a step forward in the state of Connecticut. My concern is, how do people apply for this program, or is this just through DSS or DDS to put them in the slots to obtain this service? And secondly, I think the big thing that troubles me, and I haven't talked to Kathy about this, but when you talk about 170 that are receiving this service, and you have over 1,100 on a waiting list, to me, that's troubling, because you hear of school districts, and I know of 2 school districts right now that have autism kids that are getting no services, and I'm trying to work very hard to get that to happen, but they are so understaffed with paraprofessionals and what have you. I think this is a great service, but it's troubling when you see we're servicing 170 with just this one part of this program. You got almost 1,100 on a waiting list. Is there a plan going forward?
Representative Case, I can certainly address your question in terms of the application process. So you are correct. The application process does still go through Department of Developmental Services, where their clinicians, Dr. Kathleen Murphy and Dr. Steven Zuckerman, vet the applications to ensure that the client has a diagnosis of autism. They obtain neuropsychological evaluations and any school records as necessary. That doesn't necessarily mean that they're going to right away obtain services. They'll vet the application and approve them to go on to the autism waiver waiting list. So that's how that process works, but they do all of the clinical assessment of the application and all of the supporting documents at DDS. And then that flows here to DSS, to me and to my administrative assistant. To address the enormous waiting list, I would love to put all 1,900 that are on my program right now. I mean, we have a great program with great services, but I need funding for that.
Yep, Representative Case, if I could just jump in on that too, just agreeing with you that it would be nice to serve more. We were very fortunate to be appropriated the additional slots. Happy to serve more, willing to serve more, and willing to work with the legislature on expansion of that. There's a lot of people on the waiting list. We share your concern about individuals not getting those services. So happy to work with the legislature on additional slots if that's what you'd like to talk about.
Well, you and I will have many conversations, because I appreciate it. We should not leave anybody on a waiting list, to our best of our ability. But thank you.
And I will also just say, if they're not necessarily eligible or able to get on the waiver, then we could certainly talk to you about other potential avenues for those children to get services in the community through other means.
Thank you. Thank you, Madam Chair.
You're welcome, sir. Can I just pick up on what Representative Case question? How much do we pay for this program now, and how much of it is state and how much of it is federal? Anybody?
Let us see if we can answer that question by the end of the meeting. We will get the state and federal share.
Okay, well, do you have the total cost for the whole program period, just right now?
do not have that at my fingertips. Amy, do you have that?
I don't have it at my fingertips, but I know I have it. I could get that to you.
I would appreciate that. I think we need to know what is the universe of what we're talking about in the dollars, so that we can, if we are going to try and address the waiting list, I think we need to have some starting points right now.
I think, Madam Chair, we are doing a waiver, so we know how much the waiver is. We could just add that into the amount of people who are on the waiver to figure out how much that costs. Right?
Yeah, well, that's
How much is this waiver to pay?
good question. They're going to tell us at the end of this discussion. So we'll get right back to that. Representative Porter.
Thank you, Madam Chair. I just want to go back to the life skills coaching. You talked about the qualification has been revised, and then you said training requirements were inserted. Can you just expound a little bit on what those training requirements are that were inserted, like an overview? And then also the other thing I want to know is, are they required to be hired, or is this training they receive once they're hired? And I mean, the concern is coming from that we're going from degree to non-degree. So where's the experience coming in if it hasn't been through academic experience? Thank you, Madam Chair.
Thank you.
Thank you, Representative Porter. So for the program, the training requirements was going to be made mandatory on a quarterly basis. It's a 4-hour training every quarter with a curriculum that is offered through my contractor, CCSN, with a very robust curriculum. And I could certainly get that curriculum to all of you if you would like to see that. And I think that that certainly should be a mandatory requirement for not only the bachelor's level life skills coaching, but also for those that have the high school diploma with experience, because it is robust and it's very important to the work that they do. I don't know if that helps to answer.
It does. Thank you. That was a question that was posed to me, and I thought it would be good to get the answer on the record. So thank you for that, and thank you, Madam Chair.
Welcome. Thank you.
Thank you. I see Commissioner Gifford has her hand. Maybe she's going to answer one of the questions. So Commissioner Gifford.
Thank you, Representative. I did just want to note that the average cost of individuals on the waiver is around $19,000. But the cap is around $50,000 per waiver participant. So we are finding, I mean, our experience is showing that the need is not as great as $50,000. There may be some who obviously an average is just that. There may be some who use a higher amount, but in consideration of this desire to serve additional participants and where we are on the cap, that may be a variable, to consider in terms of ways that we could potentially expand the availability of these services to others. And I did just want to build on Bill's point as well, that these waiver services are separate and apart from other services that we have within Husky. That might be able to, these are not the only autism related services in the Husky program, is what I want to make sure that everybody is aware of. These are the waiver services for individuals with pretty severe functional limitations, as I mentioned in my introductory comments. So I just want people to I don't want people to leave the hearing thinking that we only serve 170 individuals with autism in the Husky program, that this is a subset of the services we provide.
Thank you for clearing that up, because I was waiting for everybody to ask questions, and I was going to ask that exact question. So thank you very much. Next, we have Representative McCarty.
Yes, thank you very much, Madam Chair. And just for a little bit of clarification, some of my points were already covered. I did appreciate the commissioner's comment about the $50,000 cap, and just wondered, is that cap determined by DSS or on the federal side. And then when we look at the qualifications of the life skill, you know, and I know there's a shortage and we need to do something, so I'm not arguing that point, but I'm wondering, will those individuals also have access to the virtual training that was discussed earlier? I'm just wondering, or will that be carved out somehow with those individuals? And then just a little more clarification that these are for home-based services and in the community. And what, if just an explanation, I noticed on the bottom of one of the areas that it does not relate to the group homes in any way. So just a little clarification on that. Thank you very much, Madam Chair.
Thank you.
Representative McCarty, I could speak to the training. The training is held virtually at this time. So it's a good opportunity for those to attend, not have to leave their workplace, or, you know, to have more ease of sitting through that training. So that's a benefit that my contractor is able to offer. And again, as I said before, I can certainly circulate the trainings that are held and how often, and so you could just get an understanding for, you know, the plethora of topics that are covered. We do not have group homes under the autism waiver, to answer that other question. I think that's more of a DDS model. And you had asked something else, and I'm sorry.
And thank you for that reminder on the group homes. I thought so. It was just on how is the cap determined and how are the services, how DSS is paying those services. Just a little clarification there. And they can be self-directed services, if I'm not mistaken. Is that correct?
That is correct. They can be self-directed services. The clients can be receiving services under the waiver, but also can be receiving, we have a few that are receiving community first choice services as well, for those who need some additional support for physical care needs. So we do have a few that do receive that. The cap is, go ahead, I'm sorry.
Those are typically state decisions. And I believe that the team who's been around longer than me can weigh in, but I believe we have made adjustments to the cap on this waiver in the past. So there is not a federal limit, to my knowledge, on this.
So when we did last renew the waiver in 2018, we did reduce the cost cap from, it was 60,000. Some of you may have remembered that. We did go down to 50,000 to reduce, which did not negatively affect our participants at all.
Thank you very much. That does clarify greatly for me, and I appreciate that. Thank you, Madam Chair.
Thank you. Representative Abercrombie.
Thank you, Madam Chair, and thank you to the team from DSS that's here today. Just some clarifying information. So I am currently the co-chair of the Autism Advisory Council. We did have a meeting this morning before this meeting. I just wanted to give some of the feedback from that meeting. Amy did report out to the council about the changes in the waiver. They were supportive of all of the changes. The only question was, and I think my colleagues here have asked it also, is about the life skills training. And what I will say to you is, just because I have a I have a bachelor's degree, doesn't mean that my degree is in life skills, right? And that's why we believed on the council, and it wasn't unanimous, I will say that if you're going to do a training, everyone should have that training, because it should be consistent for the workforce that we're developing. I want to give kudos to DSS for thinking outside the box, because we do have a shortage in this area of people who have lived skills, right? Just because you have a degree does not mean that your degree is in that area, right? You still have to train people, but there are people that are out there that are doing this work. So I want to give them kudos that they're thinking about that population and bringing them in. I will tell you that you may get some calls from some of the providers that were concerned about having to do a training. But let me just say this, as somebody that's worked on this for this population for over 16 years, The way we get ourselves in trouble as legislators is by not being consistent. If we're going to train people, everyone should have the same training so that families don't come back and say, hey, my worker in Meriden does this, but my worker in Guilford does this. Everybody should be doing the same type of work. Our constituents should be getting the same level of treatment from everybody. So DSS is working on, at this point, looking at maybe having some kind of payment for the training, because according to the providers, and I always like to be transparent, they don't make any money on this particular service. So to add another component of having to do a training, that part they were concerned about. But I think that we all want to make sure that if there are individuals out there working with our most vulnerable population, that they're all trained the same way. As far as people coming off the waiver, and I think Representative Case and all my colleagues, we all agree, yes, we don't want anybody on the wait list. But let's just be honest, folks. We haven't moved people off this waiver in over 10 years, right? Well, less than that because it hasn't been around for 10 years, but from the beginning, right? So we need to give kudos to the fact that 2 years ago, we in our legislative budget moved 50 people off the wait list. And then the governor in this year's budget moved another 150. It's the will of this legislature and the will of appropriations to put the money in to move these individuals off the wait list. So when you ask questions of DSS, you know, you also have to put the money in to move these individuals. You're gonna, and I'm gonna tell you right now, you're gonna get a lot of calls come January because the council, the Autism Council, is all over this and they want to see that be added to. The other piece that you have to remember is they also have to hire staff, right? Because you have to have case managers that look at the individuals and come up with a plan. That takes time and that also takes money. So when you think about this, please include all of those components when you craft your budget in the next legislative session. Thank you, Madam Chair, and thank you to DSS.
Thank you, Madam. I have a couple of questions. On the autism waiver, what is the age range of the clients that are on this specific waiver? Amy or
Sure.
Mhm.
Representative Walker, it's a lifespan waiver. So we have clients on the waiver currently from the age of 8, and our oldest right now is 67.
Okay.
And when they turn 65, they have the option of whether they wish to stay on the waiver if they're being served well, or to transition to the Connecticut Home Care Program for elders. So it is a lifespan waiver.
Okay, and so I noticed that the IQ level is got to be 70 or greater. What happens if the IQ level is lower than 70?
So that is indicative that they're a client of the Department of Developmental Services.
Okay.
And at that point, they can be considered for programming at that agency.
Okay, so this one would not be considered part of the DDS community. This is a
Correct.
separate entity. Okay.
Correct.
And I guess, let me see, are there any other questions if anybody else has it? Because the other question, why is the amount for the nutrition so low? It seems very low. So can you tell me, I saw that it says 25 hours a year. So the 25 hours a year, is that considered 3,400 for the 25 hours a year, or is that the total amount that we're putting in for the nutrition counseling?
So to answer that question,
it says that it says that the program is going to increase their cost by 3,400.
oh, okay, so that would
With
be
the
a
nutrition.
fiscal question. I could go back and have them clarify that for me, but basically what was indicated is that they took the waiver, which is the DDS waivers where that service stands, and then they estimated the cost based on that waiver and translated it to what our need would be on this waiver, which came to a very low cost, but I could ask for that to be clarified further. Again, not being fiscally minded, I could ask for further clarification.
I mean, we are appropriations and human services, so we really do like to know exactly what exactly we're doing. Senator Anwar.
Thank you, Madam Chair. Actually, this is my second series of questions. You mentioned about face-to-face versus virtual. Who will determine who gets face-to-face versus virtual? In other words, will face-to-face be the first choice?
Sure, Senator, face-to-face would be the first choice if the client and the family or the responsible party was comfortable with that. There are still some that have some fear because of the issue that we experience with COVID. But we would like to see our clients in their environment, which is very important to ensure that there's no concerns in their environment and to ensure the safety. So that is the first choice. It would be up to the case manager and the client to determine their person-centered plan of care and what best fit their needs. But that I would ask that be the first choice, absolutely.
And the second question I wanted to ask you was, is there a needs assessment study that you could refer us to for because some of the clients have very specific needs, but there's probably some data to suggest that there is broadly needs that are common to all. It would be nice to have some of that insight. And again, the work that you guys do is such critical work, and I can't thank you enough on behalf of many of the people in my community and across the state for what you do at DSS, but also what DDS does as well.
Sure, and we could certainly look at getting some data. We use an evidence-based tool from Interi that our case managers use with the help of our partners at UConn to assess all of our clients, which does pull some data and commonalities between all of our clients. That's something that I could work on, certainly.
Thank you so much. Thank you, Madam Chair.
Thank you, sir. Representative Hughes.
Thank you, Madam Chair, and thank you again, Amy, and all your team for putting this carefully amended plan together. A question, as we look at the scope, and just because the whole legislature is here, I'm pretty excited that we're starting to identify more folks within our community that need these wraparound services, right? And we're starting to identify, like nutrition, some of the services and maybe even life skills that could be added to really help people thrive. And I'm just wondering, have we done a needs assessment about who's in the pipeline for this waiver program that's so that we can, as a legislature, really start to assess and fund properly the services in the future?
So,
including case management, by the way, because case management's so important.
yes, absolutely. No, I have wonderful staff. For those of you that know them, no, we haven't done a needs assessment of who's in the pipeline. We're kind of right now working on that next group of 150, and maybe I'm wrong in saying that. We are looking at their situations, trying to determine if folks need to be referred back to DDS because their situations have changed, because they've been on the waiting list. Right now, we're taking applications from 2013. So
wow.
Here we are, 2022. So some of their situations could have changed, who may be more appropriate for DMIS services. So in that regards, quasi needs assessment we're doing, but not specifically a deep dive until they're actually assigned a case manager and they're assessing them, individually.
I just want us to be prepared because I think the number is exponential out there,
Yeah.
and we might as well, get the data and address it, pragmatically as we go forward, right?
Yeah.
Right, Co-Chair of Appropriations.
Yes, it is very important, and thank you, Representative, for pointing that out. Thank you. Commissioner Gifford.
Thank you, Representative. I just wanted to give you the total cost number that you would ask for, and I apologize for not having that right at hand in the introductory comments. But
you don't have that much to do. I don't know why you don't have that right there.
But
I'm kidding. I'm kidding. Thank you for finding this out.
yeah, what was Bill? So thanks to him, he's organized. For state fiscal year 22, estimated costs for this waiver are $1,472,000. That was based on a participant number of 111. So, you know, you could scale it up based on the average cost that we shared, but that's about where we estimate we are in the current fiscal year.
Okay, and how much is the federal?
You know, it's going to vary depending on the mix, right? Because we'll have some people on camp that are higher, we'll have some adults that are in expansion population, et cetera. I would use to be safe, probably in the 60% federal match range, because that's what we use generally for the overall program.
Okay, so with those numbers, the expectation of adding the additional 150 would be on top of the 1.4, so that would bring us up to about 2 million, possibly, if I'm estimating.
Well, no, this 1.4 million is based on 111 members served, so it would essentially double the total amount by adding another 150.
Okay.
To Amy's point, and as we saw last year when we added the 50 new slots, it's not overnight that we're able to add them in, right? We need to hire this intensive case management that's involved, and we're struggling to hire nurses the way the rest of the healthcare sector is. So they'll come on slowly over the course of the year.
Thank you.
And the biggest piece to that, Representative Walker, is the financial eligibility, because they have to apply for Medicaid. That could take, you know, a little while for them to be able to do that. They may need guidance with having special needs trusts. I mean, there's so many variables, so it could make their entrance into the waiver, you know, very quickly, or it could be prolonged over months. So it varies.
Okay, so then, someone mentioned that there are other waivers that address the autism population, or not necessarily other waivers, other grants or funds. I'm not aware of it. I'm not asking you to tell me what they are now, but is it possible that you could send Madam Administrator Sukeen that information so that I could get it and all the rest of the members for the Human Services and Appropriations to get it, because autism is something that many of us are hearing about. And my other question on that is, how do people, now these are services that people are receiving at home. How do families learn about it? Is it through their pediatrician or their doctors? Do we have a way of sending out information about it? How do people learn about the programs that we have for autism?
Representative Walker, I could jump in quickly on that. We're happy to send you some information on what we cover under our state plan for individuals under the age of 21 and what kind of services are available statewide for those individuals. And yes, you're absolutely right. They hear about them from a variety of sources, including pediatricians, because we pay for screening separately as part of our well child visit. So we've tried to encourage pediatricians, primary care practitioners to screen for developmental disabilities, autism, behavioral health. Separately, we pay for that screening completely separately from the well child visit, hopefully encouraging more screenings and education about how to make referrals for home-based autism services, at least for individuals under the age of 21. We were supposed to do a presentation for the Autism Council this morning. There was a little bit of hiccup on that, but that is a kind of a well-polished presentation that Beacon Health Options does and gives you a sense of how many people we're serving in that area.
So it would be appreciated, because I know many of us get calls for exactly how do I access services. And I have been saying, hopefully, that you're learning about it through the pediatricians, but it would be really great if we could have a little bit more formal way of telling our constituents out there how they can learn about the population and the services that they need for the people that they're working with or loved ones. Let's see, Representative Case.
Thank you, Madam Chair. I'm putting my appropriations previous hat on. Human services, we like to service all, but I hear three numbers and you sparked a question for me. So 111 was the $1.4 million. Then we were talking at the beginning of the meeting of 170 and then adding another 150. So is the true number as of June this year or July this year going to be 420 people served? Am I correct in hearing that? Because I heard another 150 were added during legislation. So the 1.4 did 111. That's about $13,000 per person. And then you heard 170.
Yeah.
And then if you add another 150, you're at 320.
Amy, we're at 170 now, right?
Yeah, so I can answer that. So we had 111, we added 50 legislatively, so at 161.
Are we
Then I
servicing those full 170 now?
170 now, yes. But the 161 to 170, I had some attrition. I had some folks that moved out of state. So we replaced those. As somebody comes off, I replaced them. We had a couple of folks that no longer wanted to receive services. So that's where that missing 9 came from. So I'm currently at a total of 170.
And you're adding another 150?
Adding another 150, correct.
And where does that money come from? A waiver? Out of this waiver?
That was money that was appropriated.
In the budget?
In the budget.
Correct.
So that doesn't have anything to do with this waiver today?
No.
Oh, wait, we're adding the 150 slots to the waiver.
Correct. We're going to start adding them as soon as I have my staff on board in October. We're going to start to bring them on.
So that is a component part of this waiver amendment.
Representative, you look puzzled. It was appropriated in the budget, and now this is the step where we go to CMS, our federal partners, to add those numbers to the actual waiver. So the state part of it is done, and this is the federal part, so that they're clear on where we are.
Okay. Representative Case, does that help you?
Yeah, I don't know. I think you sparked the question, and I think we just want the bottom line number of what the state monies is and what the federal monies is, so that we make sure that we are taking care of everybody that we need to on this waiver. I was reading your mind, trying to figure out the final number. That's all we really need, right?
I know. Well, we're going to get it. We're going to get the final number. I guarantee you. We will understand that within the week, I'm sure. I want to thank everybody. Are there any other questions before I conclude this public hearing? No. Commissioner, I want to thank you and your staff for coming and talking to us. This is something that we all have been talking about for a long time, and how we help different populations in Connecticut that need the services, and especially trying to provide them in homes so that we don't get caught up in using institutions as our only method of delivering services. So we thank you also for that too. And if I'm correct, there are no more things to discuss. So I will conclude this public hearing at this time. Thank you. Okay, so we will now go into our committee meetings, and I will turn this part of the meeting over to the Human Services Committee.
Thank you, Madam Chair. For the Human Services Committee members only, I'll entertain a motion to approve the autism waiver, renewal, and amendment.
So moved.
Representative Jason?
Second,
Santiago.
It was moved by Case and seconded by Dathan. Are there any questions or comments? Seeing none. Cass, can you call the roll, please?
Yep. Representative Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore, yes. Did you hear that? Moore, yes.
Yes, there we go. Senator Berthel.
Hi, good afternoon. Senator Berthel votes yes.
Thank you. Representative Case.
Representative Case votes yes.
Thank you. Senator Leeper. Or excuse me, Senator
Representative Leeper.
Sorry, Representative Leeper. I'll go ahead.
Representative Leeper votes yes.
Thank you. Senator Lesser. Okay. Senator Cabrera. Representative Butler. Representative Cook.
Representative Cook votes yes.
Thank you. Representative Dathan.
Representative Dathan votes yes.
Thank you. Representative Garibay.
Representative Garibay votes yes.
Thank you. Representative Goupil.
Representative Goupil votes yes.
Thanks. Representative Hughes.
Representative Hughes votes yes.
Thank you. Representative Santiago.
Santiago votes yes.
Thank you. Representative Stallworth. Representative Aurora. Representative Buckby.
Senator Buckby votes yes.
Thank you.
Thank you.
Representative Mastro Francesco.
Representative Mastro Francesco votes yes.
Thank you. Representative Scott.
Representative Scott votes yes.
Thank you. And Representative Wood.
Representative Wood votes yes.
Thank you, Madam Chair.
Thank you, Cass. Is
Madam
there anyone that did not? Oh, there he is. Senator Lesser.
Senator Lester in the affirmative.
Thank you.
Thank you, sir. Is there anyone else from the Human Services Committee that did not vote that would like to vote now?
I need to vote.
Senator, you're not on Human Services, sir.
Oh,
You're
I'm
next
sorry.
That's okay. You're next.
I came late to the party asking questions. I'll be up next. Thank you.
Not a problem, sir. You're up next. Is there anybody else from Human Services that did not get a chance to vote that would like to vote now before we close it? Seeing none. Cass, can you give us a tally, please?
Yep. With 16 voting, 16 yays, 0 nays, 0 abstentions, and 4 absent and not voting.
So the waiver is approved from the Human Services. We will recess and go on to appropriations.
Thank you. Thank you, Madam Chair. I would like to convene the Appropriations Committee today. I'd like to have a motion and a second for the renewal amendment.
So moved, Nolan.
Of the
Second.
home. It's been
Second, Representative Dathan.
Okay, it's been moved by Representative Nolan and second by Representative Dathan. Are there any, is there any discussion on the waiver that we had before us today? No, okay. If not, Madam Administrator, would you please call the roll?
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Representative Walker votes in the affirmative.
Senator Hartley. Representative Dathan.
Representative Dathan votes yes.
Representative Nolan.
Nolan in the affirmative.
Senator Minor. Representative France.
Senator France votes yes.
Representative Abercrombie.
Representative Abercrombie votes yes.
Senator Doherty Abrams. Senator Anwar.
Senator Anwar votes yes.
Representative Baker.
Representative Baker votes yes.
Representative Betts.
Representative Betts votes yes.
Representative Belinsky. Representative Candelaria.
Candelaria votes yes.
Senator Ciccarella. Representative Curry.
Representative Curry votes yes.
Representative Delaney,
Representative Delaney votes yes.
Representative Dillon,
Representative Dillon votes yes.
one more time.
Representative Dillon votes yes.
Great, thank you. Representative Felipe,
Representative Felipe votes yes.
Representative Ferraro,
Representative Ferraro votes yes.
Senator Flexer,
Senator Flexer votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Gonzalez, Representative Haddad,
Representative Haddad votes yes.
Representative Carol Hall, Representative Joshua Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hayes, Representative Howard, Representative Johnson, Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser, Senator Lesser, Senator Lopes,
Senator Lopes votes yes.
Representative Luxembourg,
Representative Luxembourg votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, it's now your turn.
Well. Senator McCoy votes yes. Suzanne, yes and yes.
Thank you, sir. Representative Paris,
Representative Paris votes yes.
Representative Cavalac-D'Amato,
Cavalac-D'Amato votes yes.
Representative Porter,
Representative Porter votes in the affirmative.
Representative Reyes, Representative Reyes, Representative Rosario,
Representative Rosario votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Representative Sanchez votes yes.
Representative Sims, Senator Summers, Representative Terciak,
Representative Terciak votes yes. Thank you.
Representative Wilson,
Senator Wilson votes yes.
Senator Winfield,
Senator Winfield in the affirmative.
Representative Zawistowski,
Representative Zawistowski votes yes.
Madam Administrator,
Senator Lesser.
Senator Lesser in the affirmative.
Thank you, sir. Representative Johnson,
Madam Administrator, Representative Johnson votes in the affirmative. Thank you.
thank you. Are there any other members of the, I see a Representative Hall. Which one are you?
Representative Joshua Hall votes yes.
Thank you, sir. Are there any other members of the Appropriations Committee who have not yet? Oh, Representative Howard, hi.
Hey, good afternoon, Sue. Representative Howard votes yes.
Thank you, sir. Any other members of the Appropriations Committee who would like to cast their vote? All set, Madam Chair.
Thank you. Madam Administrator, please report the tally.
Total number voting 40, those voting yea 40, those voting nay 0, those abstaining 0, those absent not voting 11.
Thank you, Madam Administrator. So the amendment and renewal passes. I just want to say to, I got information just a few minutes ago that for 2022, the final is 1.65 million. For 2023, projected is 4.8 million. These are total costs, and the federal share is 50% of that. And I'm sure we'll get that in writing, but I just wanted to give everybody that information. May I have a motion to adjourn?
So moved by Porter.
Second, Representative Nathan.
And second by this Representative Nathan. Appropriations adjourns. Thank you.
I will reconvene the Human Services Committee for the purposes of adjourning the meeting. Can I have a motion to adjourn?
So moved by Cook. Second, Representative Nathan.
Moved by Cook, seconded by Dathan. I now adjourn this Human Services meeting. Thanks, everybody. Have a great day.
Have a good day. Thank you. Thank you,
Kathy.
DSS.
Kathy, what else do we have coming up? What's next?
Me?
Sue, not you, Kathy. I'm sorry, Sue.
Oh.
Next Wednesday, the 28th.
Which one is that?
These two committees, plus our friends in the Public Health Committee, will be having a joint public hearing on the remainder of the Health and Human Services block grant allocation plans, with committee meetings to follow. And once again, a reminder to all members of the committees that votes will not be held open, so that we can assure that the three committees are voting in concurrence.
I'm sorry, Susan, would you repeat the date, the day and the time? I'm just
Wednesday the 28th, 10 a.m.
Thank you.
I may have not said the time. My apologies. 10 a.m.
That's okay. That's all right. It's just so that we don't have to call everybody. Some people will be here. Thank you. Everybody have a great day, and thank you.
Tony.
Yes.
Say.
Oh, good. Happy birthday.
Thank you.
Everybody have a wonderful day, and you have a sparkling birthday as you knock on doors. Bye.
Bring your bouquet. Bring your bouquet with you.
Yeah,
I will.
They'll be kind.
All right, I'll see you guys later.
Bye.
Happy birthday.